Phoebe Agoru. I am a student of Texas State University, the Nurse Practitioner Program. In this ethical stance video, I am taking the constance on the case of disagreement over advance directive. This is a case of an 80 years old male patient who has multiple medical problems, end-stage renal disease, dementia, stroke, bedridden, and with low blood pressure. The patient is not responsible to medical team treatments. In 2010, the patient has advanced directive which states if only artificially prolonging life and no meaningful interaction with family withhold treatments. The daughter disagrees to the medical team determination of proceeding with a comfort measure, which the family and the other siblings agreed to. But the daughter, who appears to be the durable power of attorney and has taken time off from work to assume primary care provider to the father, disagrees to this. I'm taking a constance in that the patient's rights need to be upheld. Ethical decision making is a very delicate issue, very difficult for everyone concerned, especially when losing a loved one is looming large around the corner, and it should be approached delicately. As APRNs, it is our responsibility to support our patients, loved ones, previously determined healthcare decisions, mitigate and advocate for them in this kind of situation when needed. Questions that could arise during ethical decision for nurses is: have I succeeded as an advocate for my patient in the best possible way? Have I determined and mentioned clinically relevant nursing care information to my patients? End of life cases is not an easy one for one to battle with. And patients' interests, values, beliefs, and life goals should be our priority as nurse practitioners and as nurses. Dennis Code 2021 noted the importance of Self-Determination Act, which is a federal law with mandatory compliance, which is meant to improve patients' decision-making process, especially related to end-of-life situations, prioritize patients' rights and to their right to accept or refuse interventions, and also to improve providers' obligations to provide appropriate information to patients. So, with our own case, this patient has written advance directive that need to be followed. Cases that are looked at says that the best advance directive, the best working advance directive are the ones that the patients previously have determined and put in a written form, and patients may also have gone ahead and appointed a durable power of attorney or a proxy, a surrogate that will make decision for them in case of the possibility of them not being able to make decision for themselves. So, similar case that I looked at in an article suggested that court proceedings may actually be necessary in cases like this to help if a family member is not convinced by the medical team. So court proceedings should be started. But we know that environment is not an appropriate place for end of life cases. So, and some other research that I also looked at actually says that the best proxies are spousal proxies, and they are found to make more accurate decisions representing the patient's interests than those of adult children. And proxies with high degree of family conflict or less accurate than those with less conflict. So with this patient's daughter, which is an adult, so if the wife of the patient were to be there, they will make more decisions that will reflect the patient's interest than the daughter will represent. But the thing is that the patient already has a standing advance directive that says withhold treatment if he is no longer responding, if he cannot have meaningful communication with his family. So why should we keep prolonging his life if it is not necessary? We may actually be doing more harm to him. The case of non-malfeasance, which is another ethical issue if we continue providing treatment for him. So this is a case of autonomy. So the patient has the autonomy to determine the kind of treatment that they want to receive at the time of end of life situation. So my constance is against the doctor's decision to continue dialysis. Thank you.